Hello and welcome back to another video. So there are a lot of videos that promote lower ab exercises, similar to the ones shown here. And the problem with that is there is no such thing as lower ab exercises. You can't only contract the lower portion of your abdominals and not the rest. Okay? They either all contract together as a unit or they don't. You only got one nerve that innervates the rectus abdominals, and they either all contract when called upon to contract, and they relax when they're called upon to relax. So when we look at the abdominals, look at the location, you can see that they attach up here at the ribs and down at the pubic symphysis. So they do not cross or have attachments at the hip joint. So that means they do not do any of the leg movements that are shown in these videos. They flex the spine. The muscles you are actually feeling during these exercises are the hip flexors. So we have the Iliopsoas, we have the rectus femoris, and we can also throw in the TFL. So those are the muscles that you are essentially feeling when you are doing those lower ab exercises. And the reason why it feels like it is in the lower abdominals is because of the location of these muscles, okay? Especially the iliac and the psoas muscles. They are right in that region where a lot of you feel that burning sensation, and that burning sensation can intensify the feeling of engagement, especially in the lower abdominal region. So it feels like it's the lower abdominals working harder, but essentially it is those hip flexors, the location of the hip flexors, that are causing that burning sensation. And these exercises are so popular because a lot of you have that desire to lose that stubborn belly fat that's located right in that lower abdominal region. And why that is so problematic is because if we look at the location of the iliopsoas, you can see that the psoas muscle attaches to your lumbar discs and wraps into that femur. So it has actions that influence your hip and low back. If you are someone that sits all day and your hip flexors become nice and tight, if you do exercises that increase that tightness, we're creating more muscle imbalance between our hip flexors and our hip extensors, which means our hip flexors are going to be tight, and it's going to essentially prevent our gluteus maximus from engaging. This is 100% going to cause low back issues, and it's going to cause hip issues simply because of where those muscles are attached. So as these muscles become tight, it can cause your lumbar disc to become compressed. It also can pull our lumbar spine anteriorly, okay, causing us to have postural distortions, and those postural distortions eventually can lead to injury, it can lead to pain, and it's just a cascading effect, all because of that dysfunction within our hip flexors. And yes, there can be some rectus abdominal engagement during these exercises, especially if we flex our spine and we keep our core engaged to stabilize us as we're doing some of these movements. But it's not worth the risk in having continual back pain or hip pain doing these exercises when there are many better exercises that you can do for your core that won't impact your low back in such a negative way. I had to make a video to clarify and say why these exercises can be so problematic, because I'd have clients over the years that would have hip and low back pain, and I'd ask them specifically if these were any of the exercises they were doing, and sure enough, they were doing one or several of these exercises that were deemed lower ab exercises. And so I had them stop doing those exercises, and naturally they started getting better, okay? So the more you understand about some of the exercises you do, the better it will help you progress in your journey to a pain-free life, and also understanding your body to know what you're doing that's hurting it versus what you're gonna do that's going to help it, okay? So that's why I make content like this, so you guys can get a better understanding of those things and learn your body a little bit better, learn about the muscles a little bit better and what the exercises involve. And hopefully you just take that knowledge and you just build from there, so you're not having any pain while you're doing exercises. okay? Because you shouldn't have pain when you exercise. If you do have pain when you exercise, it's likely doing things that you shouldn't be doing, or you're doing things incorrectly. So I'm trying to shed light on both of those topics there. All right, so thank you for watching. Hopefully you learned something. Like and subscribe if you like listening to my content, and thank you for watching.